we're going to talk about, can I augment my breast without having an implant? And the answer is yes, of course you can. I'm not sure if you've researched in the past, but there were a product called Macrolane. Now it's off the market, which basically people injected stuff into their breast to increase its size. It had its issues, and now it's not a practice anymore. But we can use your own fat. We can use fat, we do liposuction, we filter the fat, we process it, and then we inject it back into your breast. It's not a bad way of augmenting the breast, but it's a limited way. For example, you're limited by size to how much fat you can put into a breast. It mainly increases size rather than control shape properly, and of course it's also influenced by whether you lose weight or gain weight. Now, the most fundamental part is, how fat are you? Because you need fat, and you need a lot of fat. So if you're going to take, a cup size increase in an average size breast, you will need around 400 to 500 mils of fat per breast. You need that to be harvested from somewhere in your body. So if you're really, really skinny or really, really fit, we don't have that fat. And if we look at what some people do and say, oh, look, I liposuctioned a liter. But when you look closer at that liter, there's only about half of it fat, and we have to divide that between the two breasts. The other fundamental thing if you ever consider this procedure, you should never lose weight in the first 3 months after having a fat graft, because if you do, you're going to kill my fat graft. So make sure you actually don't lose weight or gain a bit of weight in the first 3 months after surgery. Also have realistic expectations, because I can't make you a double D cup from an A cup by doing a fat graft. For 2 reasons. One, there's too much pressure from the skin and I can't expand it enough. And the other part is, where do I get the fat from? Also, there's always a percentage loss of fat, and that depends on who's doing it and what technique is used. But anything from 10% to about 15-20% is acceptable, but sometimes goes to about 50%, and that's not acceptable. Also, future, if you lose weight or gain weight, this might affect the fat in your breasts. It is a technique, it's used and used a lot, but we have to be careful and have realistic expectations. So discuss it quite well with your surgeon, because the last thing is you pay the money, have the procedure, and you don't gain much. So consider options before you make decision. Thank you.